How do doctors get a tiny, vital clue from deep inside your body without major surgery, especially when they suspect something serious like pancreatic cancer? It is a remarkable procedure that helps uncover crucial information for diagnosis and treatment planning. An Ercp biopsy for pancreatic cancer is a specialized diagnostic procedure that combines endoscopy with X-ray imaging to visualize the bile and pancreatic ducts, and then collect tissue samples for examination. Ercp stands for endoscopic retrograde cholangiopancreatography. It is performed when other imaging tests suggest a problem in these ducts that could indicate pancreatic cancer. This procedure allows doctors to directly access and obtain a small piece of suspicious tissue for laboratory analysis, which is essential for confirming a diagnosis of cancer. The why behind Ercp's effectiveness lies in its unique ability to reach areas of the pancreas that are difficult to access through other means. The procedure begins with an endoscope, a thin, flexible tube with a camera, which is guided through the mouth, esophagus, stomach, and into the small intestine. Once the endoscope reaches the opening of the bile and pancreatic ducts, a very thin catheter is threaded through the endoscope and into these ducts. A contrast dye is then injected, allowing the ducts to be seen clearly on X-ray. This combination of endoscopy and X-ray is particularly powerful for identifying blockages, narrowing, or other abnormalities within these critical structures that are often associated with pancreatic tumors. The ability to directly visualize these ducts and then perform a biopsy under precise guidance makes Ercp a highly accurate tool for diagnosis. During the Ercp procedure, if an abnormal area or a blockage is identified, the doctor can then use tiny instruments passed through the endoscope to collect tissue samples. This can involve brushing cells from the duct lining or using tiny forceps to take a small piece of tissue. These samples are then sent to a pathologist who examines them under a microscope to determine if cancer cells are present. Preparing for an Ercp typically involves fasting for several hours before the procedure and discussing any medications you are taking with your doctor. After the procedure, you will be monitored for a few hours before going home, and you might experience some mild discomfort. One of the unique advantages of Ercp is its dual capability. Not only can it diagnose, but it can also offer therapeutic interventions during the same procedure. For instance, if a tumor is blocking a bile duct and causing jaundice, the doctor can place a small stent to open the blockage, relieving symptoms immediately. This is known as a therapeutic Ercp, making it a powerful tool beyond just diagnosis. Furthermore, the precision of Ercp allows for targeted sampling, increasing the likelihood of obtaining diagnostic tissue even from small or complex lesions. It is an intricate process performed by highly skilled gastroenterologists. Understanding Ercp helps you appreciate the detailed efforts involved in accurately diagnosing pancreatic conditions. This method offers a path to clarity by physically confirming the presence of cancer, which is a crucial first step in developing an effective treatment plan tailored specifically for you. The information gathered from an Ercp biopsy empowers both you and your medical team to make informed decisions and move forward with confidence.